Hi friends, I am Anoop PC National Executive Member of ISRT. Presently, I am working in Government Medical College, Thrissur. Today, my topic is Role of Sonographer in First Trimester Ultrasonography. Introduction of modern medicine reduce fetal mortality rate using USG and non-invasive imaging technique helps the early detection of fetal abnormalities. This enables doctors to save the life of a baby with proper treatment, precaution, and medicine. Who is the sonographer? Sonographer is an allied health professional who uses ultrasonography machines to create structure inside the human body. Those images are used by the doctors to make medical diagnosis. Trimester. Typical pregnancy lasts for 14 weeks from the first day of your last menstrual period, LMP. LMP, last menstrual period, has great importance in pregnancy. It is divided into 3 stages. The first 3 months of pregnancy is known as first trimester. The second 3 months is known as second trimester. The last 3 months is known as third trimester. What are the indications of the first trimester ultrasound scanning? The first one is confirmation of intrauterine pregnancy. Imagine the gestational sac and fetal pole within the uterus confirms the pregnancy. Per abdominal scan have limitation in early pregnancy. Transvaginal scan can get closer images to the uterus. Per abdominal scan means the scanning probe placed over the abdomen for getting the images. In transvaginal scan, special probes like transvaginal probes introduced into the cervix and getting images. This scanning technique always correlates with HCG. HCG means human chorionic gonadotrophic hormone. Then yolk sac. After the gestational sac becomes visible, the next positive sign of pregnancy is yolk sac. Yolk sac provides nutrition to the developing embryo until placenta develops. Yolk sac is just like a food that's given to the embryo. Then, second indication for first trimester ultrasound scan is evaluation of ectopic pregnancy. What is ectopic pregnancy? That means ectopic pregnancy is the embryo is not seen inside the uterus. Usually, ectopic patients have pelvic pain and vaginal bleeding, but the UPT is positive. But the embryo is not seen inside the uterus. But the patient UPT during pregnancy test is positive, but we cannot see the embryo inside the uterus. It is very difficult to diagnose at this stage. Sometimes it is commonly the ectopic pregnancy is seen in fallopian tubules. Fallopian tubes. The other areas of ectopic pregnancy are ambulate, isthmus, fimbria, and cord. This is the ectopic pregnancy. This is left ovary. See, the ectopic pregnancy is not seen inside the uterus, but it is seen in the fallopian tube. The third indication of first trimester scanning is estimation of gestational age. Gestational sac diameter and crowd from length is the primary means of evaluating gestational age in first trimester. This is the mean diameter of the gestational sac. This is the chron length, that is CRL. This scanning is usually preferred in 90 to 12 weeks. There is a table in the software that indicates the number of weeks corresponding to CRL. That means if the CRL, just like that, if the CRL is 1.5 centimeters, the corresponding week is 6 weeks, 2 days, just like that. CRL is the largest straight line from the outer margin of the head, cephalic end to the rump, that's the buttock area, that is CRL. CRL is the largest straight line from the outer margin of the head end to the rump. Then the fourth indication of first trimester scanning is defining the cause of vaginal bleed. Possible cause of vaginal bleed include subchorionic hemorrhage, embryonic demise. Embryonic demise means embryonic death. Subchorionic means hematoma below the chorion. Chorion is a cover, is a thin membrane covering the sac, covering the embryo. It is a fetal, it's just like a fetal placenta, it's a fetal placenta. That incomplete abortion, that means abortion is not complete. Abortion happens, but the fragments of the embryo and fetus still inside the uterus. That is known as incomplete abortion. Then another thing is ectopic pregnancy that we studied earlier, the ectopic pregnancy. Then the fifth indication of first trimester ultrasound scanning is to rule out incomplete abortion. What is incomplete abortion? That means after abortion, pieces of pregnancy tissue remain within the uterus after spontaneous abortion or induced abortion. Spontaneous abortion means it is accidental abortion. The clinical features of incomplete abortion is fever, infection, and prolonged bleeding. Usually, this is very difficult to get in the abdominal scan. Usually, serious scan is done to detect the retained products of conception. Then, the sixth indication for first trimester scan is confirmation of cardiac activity. Heartbeat may first be detected by vaginal scanning as early as 5 to 6 weeks after gestation. Before that time, we cannot appreciate fetal cardiac activity. It is the first visible sign of developing embryo. No heartbeat may be the sign of miscarriages. Normal fetal heart rate in fetus is 120 to 160 beats per minute. This is a little bit higher than the adult. In adult, the normal normal heart rate is 60 to 100 beats per minute. If the bradycardia is present, means less beat, less than 100 BPM, less than 100 beats per minute is seen. The sonographer should suggest follow-up for the viability of the fetus. No heartbeat may be the signs of miscarriages. The seventh indication for first trimester ultrasound scanning is evaluation of multiple pregnancy. It is usually done at 10 weeks of pregnancy. The first trimester scan gives information about the number of fetus, chorionicity, and amnionicity. Chorionicity means just like a placenta, it is the fetal placenta. Chorionicity based on the number of placental masses. The clinical relevance of monochorionic diamniotic twin pregnancy is increased risk of shared circulation. That means in monochorionic means single placenta shares, twins or multiplies. So that what will happen? The shared circulation. That so the both fetus have decreased circulation, decreased blood flow, and decreased nutrition. It is usually associated with congenital anomalies. Congenital anomalies means the anomalies by the itself. Then the eighth indication for first trimester scanning is measurement of nuchal translucency. What is nuchal translucency? Nuchal translucency is the sonographic appearance of the fluid collection below the skin behind the fetal neck. See the image? There is a fluid collection below the skin behind the neck. It is done between 11 to 14 weeks of pregnancy. Actually, the measurement of the thickness of mucus is 1.6 to 2.4 millimeter. If it is greater than 2.4 millimeter, there is a clinical significance. The increased nuchal translucency may indicate congenital anomaly. It is the increased nuchal translucency is the indication for amniocentesis. What is amniocentesis? Amniocentesis is amniotic fluid is aspirated and sent into the genetic lab. It is the prenatal diagnosis of chromosomal abnormalities. It's very important thing. If the nuchal translucency is greater than a particular value, the amniotic fluid is aspirated from the uterus and sent into the genetic lab. Actually, it is the prenatal diagnosis of chromosomal abnormality. Sometimes the pregnancy is associated with uterine and adnexal tumors, fibroid. It may be accidental findings, maybe the accidental findings at the time of first trimester scan before the patient doesn't know about the tumor. Then the cervical length measurements and internal force should be evaluated. The cervical length less than 2.5 centimeter may indicate a preterm birth. Then I am concluding my topic. The scope of sonographer. In India, independent practice of sonographer is not allowed. Lot of hospitals, especially in urban areas, USG machines are lying useless due to the lack of sonologists. Still, technologists in India are not aware about the scope of the sonographers. Different countries in the world, especially European countries, are giving good opportunity and amenities for the sonographers. Different universities in Europe are conducting online and offline courses for sonographers. Thank you. Thank you all for watching my presentation. Thank you ISRT for giving this opportunity to present this.